Hi, I'm Dr. Murphy Mastin, and I'm a board-certified dermatologist at CMH Dermatology Clinic in Bolivar, Missouri. It's partially genetics most likely. It's more common in lighter skinned individuals, but it can happen in all types of skin colors. There's likely a component of the immune system reacting abnormally, and it's an inflammatory condition is what we consider it to be. It is a chronic condition, meaning that it is long-term and we can't cure it, but we can manage it, and we can expect relapses where it flares and periods where it might be quiescent or it might be quiet and not having any issues, but ultimately it can affect people in multiple ways. It's a genetic component most likely, and it's more common in lighter skinned individuals but can affect all skin types. But more likely it's common to occur in middle-aged adults. The fourth decade of life, so 40 years and older, is more commonly where we will see it take effect. So rosacea does have a genetic component most likely to it, and we're still learning about several skin conditions, including rosacea, which is very complex. And what can trigger it would include things like sunlight, emotions, spicy foods, alcohol consumption. Each person is different. There is some association with a mite that lives on the skin on 99% of people, and we're not sure if that triggers it or not, or is the cause. There also might be a component that's related to how the brain and the blood vessels work together, and that's sometimes why we see people flush or turn red or develop small blood vessels called telangiectasias. So rosacea ultimately was broken down into 4 different categories. The red type with blood vessels, and that's called erythematotolangictatic rosacea. There's papulopustular, which can look more like acne and be confusing to both the clinician and the patient, but is treated similarly to regular acne. There's also a phymatous type where there's thickening of the skin, and sometimes that would lead to thickening of the skin of the nose, the earlobes, the forehead, the chin. And then lastly, something that most people would probably overlook would actually be that rosacea can affect the eyes. There's ocular rosacea where there's inflammation, so styes can be a representation of rosacea in some cases, or photosensitivity, meaning that you're sensitive to light, or a gritty sensation. So those are things that I try to take into account whenever I'm assessing somebody with a possible rosacea to see if there is need for systemic therapies that might also impact the eyes in their care. Rosacea most commonly occurs on the face. To see it below the chest would be odd. So ultimately, yes, it primarily involves the face, the skin of the eyes, the eyelash margin, and also can affect the whites of the eyes as well. Since there are so many different types of rosacea, there's multiple types of treatments, and it would be tailored to the specific type of rosacea that you have, and ultimately people can have multiple types of rosacea at the same time. So it's not cookie cutter in the way that it's approached. It would be on a per patient basis. We often use creams or topicals, as we like to call them, to treat the acneiform type lesions that occur with that. There are also creams that can treat the redness. Sometimes we'll use cosmetics to camouflage the redness, and the gold standard for the treatment of the redness and the small blood vessels called telangiectasias would most likely be what's called a pulse dye laser, which is available at CMH Dermatology Clinic. Ultimately, for the phymatous types, sometimes surgery is required, especially if it's affecting ability to breathe through the nose. Also, just for distortion of the cosmetics of the face, sometimes we will intervene in that aspect. Sometimes there's oral pills that we use that are antibiotics, and it's not because you're infected or going to contaminate or pass this condition down to others. It's ultimately for its anti-inflammatory properties. As talked about earlier, rosacea is a chronic inflammatory disorder of the skin. Rosacea is a complex condition that we're still learning a lot about, but I think that ultimately in the last 10 to 20 years there's been a lot of advances in the treatment of this condition, and I think that it can be tailored to the person that walks into my office to where we can see noticeable improvement, and ultimately we're here to take care of you, and I would say that we have lots of good options for treatment. I would encourage anybody with skincare concerns to reach out to us at CMH Dermatology Clinic in Bolivar, Missouri. We're trained and capable of handling complex medical dermatology, including rashes. We specialize in skin cancer, screenings and evaluations and management. If you have any concerns, you can contact us as stated at 417-328-4500, or you can reach out to your local primary provider or physician for a referral.